they're like, but wait, you violated my privacy. And you're like, what? But to the narcissist, they're like, my privacy is mine. And then when it's mine, it's special. But now you know that maybe I'm not great. And that becomes a narcissistic wound. And that can be really problematic.
My guest today is Dr. Daniel J. Fox. He is a licensed psychologist in Texas, an international speaker, and multiple award-winning author. He has been specializing in the treatment and assessment of individuals with personality disorders for over 20 years in the state and federal prison system, universities, and in private practice. Dr. Fox, pleasure to meet you.
Hey, nice to meet you too. Thank you so much for having me on.
Delighted to have you and excited to talk to you about this. So I'll kick it off. What is the difference between, say, psychopathy and sociopathy? Like when we talk about psychopaths and we talk about sociopaths, I colloquially use these interchangeably depending on how they sound in the sentence. Like if I want to have more sibilance or something. But is there a difference? Are they synonymous? Is it more like in economics we say sociopathy, but in law we say psychopathy? Like what are the difference between these terms?
So there is actually a huge difference between the two. And your sociopath is typically more socially skilled, and they tend to be a better analyzer of the social environment. So your sociopath can read you really quickly and really well. And they do that in that we give ourselves away all the time. We give ourselves away by the jewelry we wear, how we carry ourselves, certainly the things we say, whether we have particular accents from different parts of the country or different parts of the planet, whatever it may be. They pick up all these nuances. And what they do is they turn it on you to their own betterment. But they can socialize really well. I think the best sociopath example is Anthony Soprano. And a lot of people think that he's a psychopath, but he's not. And he's not because he has a real emotional connection to his family and his compatriots, right? The people that are in his business family. We'll call them business family, right? So where's your psychopath? Now, your psychopath, there's actually a neurological deficit that Dr. Keith Keel had identified, and he has a wonderful, wonderful book. It's called The Psychopath Whisperer. And what he does fMRI studies with these psychopaths. He calls them his psychopaths. And it's interesting because we see it's a paralimbic system deficit, and which explains so much, which is that they tend to have a startle response. So you and I, we're walking down the street and there's a loud pop, whether it's a gunshot or it's a backfire from a car, right? You and I, we have this sort of instinctive, jump, right? A startle response. Your psychopath typically will not have that same startle response. So we see that there is absolutely this neurological and this physiological response. And that's that huge difference. Also, they're not, now Hannibal Lecter is a good example of something that everybody knows. However, it's very misleading because Hannibal Lecter, all psychopaths are not brilliant and they're not really good at reading environments very well. So they tend to have typical intelligence, average intelligence. They also tend to have a lot of, and the psychopaths that I met, that they tend to have a lot of patience up until the point of engagement. And what I mean by that is that they will set up a scheme. And let's say it's to hurt you or I for whatever reason. And it's not always a reason that's evident. They see it to their advantage, something that they want to do. And they're really calm. They can set up a lot of, structure and things like that, maybe lead you down a hallway. The problem is when you get to that end of that hallway, they get excited. And because they're about to really do this really, really exciting thing, right? It's like when we were kids and, you opened your gift, on holiday morning and it's the train set you always wanted. And you're like, oh my God. It's that same thing. And that's where they make the mistake. That's where law enforcement can catch them and intervene. Your sociopath tend to be really impulsive. And some are planning and plotting, but again, I think it's that impulsivity. So there's so many distinctions, but there's a lot of colloquial confusion, but they're absolutely clinically separate.
So can I take a stab at trying to understand the delineation that you've made here? So a psychopath has a limbic deficit. So like I'll make this real dumb because I have no medical training at all. It sounds like a psychopath might be somebody that got kicked in the head by a donkey, or has some sort of neurological injury that is stopping them from um, engaging in certain impulse control behaviors. So
Mm-hmm.
if something exciting happens, they can't suppress it; they just react. I would imagine that means that like a sociopath might embezzle from you, but a psychopath might just flip out at the bar and hit somebody because they don't have as much control over their actions. Am I anywhere in the ballpark there?
You're close. You're close. You got the ticket, so you're almost in. So I think that what happens in that example, so your sociopath is likely to figure out, like, so in the bar example. So if they want something from you, now they may come up and beat you up, but both of them would do that. Your sociopath may experience a mild form of regret, depending on really all of the societal components. Your psychopath isn't really going to feel any regret at all. It's a blunted empathy response. It is also that while they're hurting you, while they are, whatever they're doing, they're not going to have that same increase in blood pressure, in physiological response that your sociopath neurologically,
Like
physiologically
insulin or
built like
increased
us.
heart rate,
Correct.
stuff like that. Yeah.
Yes, and that's what the limbic system controls. And we see that it is impaired in the psychopath.
Okay, interesting. Well, you brought up Anthony Soprano. I've not watched the series, but I assume that's
Oh,
the lead guy from The Sopranos,
yeah,
the mob boss character, right?
yeah.
And um, so he's an example of a sociopath.
Mhm.
So he's got high, based on what you're telling me here, he's got high EQ. He can read facial expressions. He can read tone of voice. He's good at being able to interpret what people are doing, but he's got limited empathy because it sounds like he cares
Mhm.
about his friends and family,
Mhm.
but that's like in the same way that like maybe I would I pass a homeless guy on the street. I don't know him, but I feel bad about it. Maybe I stop to talk to him or give him a hamburger or some money or something like that. He would not have that. His empathy would just be limited to the people in his life, or are people that are really a sociopathic. They just care about themselves and not even their friends and family, or how does that work?
Mhm. So your sociopath, if they feel like it can be to their benefit, if they feel like that it is going to help them in some way, they may feel for that homeless individual, right? And only if they can see that direct benefit. How does it directly benefit me? How does it help me? So perhaps giving that homeless person money, if perhaps someone else sees them, who they are manipulating, conning, whatever it may be, sees that. So let's say that they're walking down the street, right, with a woman who's very compassionate, and they want to sleep with this woman. So they're like, oh, okay, well, here's a tactic that I can, oh, look how compassionate I am. Now, a lot of people might do that, right? So it's it's a simplified example, but your psychopath wouldn't even think about that. And in regards to sex, they're horrible relationship managers, engagers, because of that lack of emotional content, and that they don't really feel those emotions. And it's not necessarily they got kicked in the head by a donkey. So that's one of the things that the Dr. Keel's trying to figure out, is that certainly we see individuals, 7, 8, 9 year olds that have impaired empathy. They have these distorted traits. They again, impaired empathy, but also acting out in violence. They may drug their babysitter and rape them, and they feel no regret. I've got a ton of different stories that I can tell you and shock you, but and they really just don't feel any regret, and they're like, well, it's what I wanted to do. I mean, what's really the big deal? And your sociopath, I think, is more likely to perhaps balance the adverse influence on them and how they can further maneuver or manage the social environment, and they're more likely to talk the babysitter into sleeping with them.
This is all fascinating, and I now have to I want to make a graph here to make sure I understand.
Watch The Sopranos.
Watch The Sopranos. Good call. This is
First one.
it's fun homework for this program.
Yeah.
So, okay, a psychopath has autonomic, limbic, physiological stunted connections that a normal person would have. Like I'm getting into an argument with you, and my adrenaline goes up, my cortisol goes up, my heart starts beating, things like that. Whereas like a psychopath may not have that; it might be disconnected. It sounds like based on what you're saying that um, sociopaths are more manipulative and have high EQ, whereas psychopaths are more like blunt and direct and have low EQ. Are they both
Mm-hmm.
about the same in terms of impulse control? Are they both about the same in terms of uh, breaking the rules? It's just that the sociopath understands that I'll get in trouble and I don't like getting in trouble, or does the sociopath actually have regret when they break the rules? Like it sounds
Mm-hmm.
like the psychopath couldn't care less. But like is the sociopath just going, oh, I don't care, but I don't want to get in trouble, or does the sociopath actually have a touch of remorse?
Mm-hmm. So I think both lack remorse in that they lack remorse for the victim. But I think that for your psychopath, I think what happens is, and they're both likely to commit crimes, they're both likely to harm others, things like that. But then they both want to avoid going to prison, getting in trouble, things of that nature. I think your sociopath's probably better at it because they're more socially skilled. They can convince their attorney, they convince the legal system that they shouldn't be incarcerated for various reasons, for this, that, and the other thing. Your psychopath isn't probably going to have that degree of social finesse or EQ, that whereas they're more likely to be like, well, I mean, all right, you're gonna lock me up. You better make sure it's forever. I mean, I've had guys actually tell me that. You better make sure if you lock me up, you better do it forever because you let me out, I'm just gonna go right back out and do it.
So is the principal difference then? Because it sounds like both of them are lacking remorse, both of them are lacking empathy. Is the main thing really just social skill, where the sociopath has higher degrees of social skill and manipulation? They're just more adroit at it, whereas the psychopath just lacks the ability to get things done using like soft influence.
Mhm. I think that it gets big if we say that this is that one discernible difference. So I don't want to overemphasize that, because again there are other nuances, but you could absolutely say that that is a pretty glaring difference. And particularly in my experience, like your sociopaths, talking to them, they're kind of interesting, and they know how to tell a good story a lot of the time. They know how to realize that you're interested in it. Your psychopathic individual, they're not good storytellers because they don't care about the listener. They don't really their goal is to just, this is what I want, and either you're going to give it to me or you're not, and I'm not going to wait for very long. So and then they tend to then act on that. But depending on the level of experience and sophistication that they may have, and I understand that this can get confusing, but I think the more that we drill down, I think the more confusing, the more nuanced I think those separations become. But so impulse control, I think for impulse control, we're talking about your sociopath, which may have more impulse control in particular situations, depending on the payoff and how long they're willing to wait. Your psychopath, again, depending on how much they feel or want that need met, they will wait and plot and plan. Also, for both, it does depend upon who they are manipulating. So they're both blind to that. So I think within the prison system for myself, to attack a psychologist is bad, but it's not as bad as if you attack the captain. So they would certainly manage, and they would both be aware that, you know what, it's easier to hurt Dr. Fox than it is, Captain such and such. So what is that, how does that get my need met, particularly for your sociopath? But then for your psychopath, maybe like, well, let's just let him have it.
Okay. So like if somebody in prison's had a bad day, they're kind of frustrated, they really want to hit somebody, a sociopath is more apt to interact with you, the psychologist who's in there, and go, I'm going to hold back, or no, excuse me, the captain comes in and he's going to go, if I punch the captain, I'm going to get in all sorts of trouble. I'm going to wait till the psychologist comes in. He's going to be a bit more sympathetic, and he doesn't have the ability to directly hurt me. So, like, I'm going to get away with more. Whereas a psychopath is just like, I want to punch somebody. I'm going to punch this guy in front of me, and is not thinking so much about the consequences or the social hierarchy.
Correct.
Okay. And are they so with both of them? Is empathy totally absent? Is it on a spectrum? Like with Tony Soprano, I've not watched the series.
Right.
Does he actually love his kids and his
Uh-huh.
or are they just reflections of his ego and that's why he
Both.
likes them, or both of them? But he does have some empathy. Is it just more limited than a regular person?
Yeah, and it's definitely on a spectrum. I think that, all of these different features and traits are, and certainly disorders, are all on a spectrum. So I think that, none of them are categorical. So they're not like a light switch on or off. So I think they're absolutely there. I think just for your sociopath, you're going to have more room, so to speak, to function, whereas I think that you're going to have very limited ability as far as like impulse control and things of that nature when it relates to the psychopath.
Okay. I had previously been told that sociopathy and psychopathy are not clinical distinctions, but the clinical term is antisocial personality disorder. But the way you're talking, it sounds like these are clinical distinctions. So was I previously misinformed, or is antisocial personality disorder an umbrella term for both of these, or what's the relationship between them?
Absolutely. Yeah, perfect. That's exactly what I was going to say. Andrew, you're so on it. You're doing great. And
Thank you.
yeah. So the DSM. So when we talk about antisocial personality disorder, so they couldn't say, okay, we're going to delineate every specific diagnosis and add these criteria, so on and so forth. So what they did is, for some disorders, and antisocial and sociopathy and psychopathy fall into this category perfectly, the umbrella term is antisocial personality disorder. But you do have individuals that just have antisocial personality disorder. And these are individuals that just break rules. They're remorseless. A good example of antisocial personality disorder is Walter White from Breaking Bad. And if you've watched the series, that early on he actually does have early indicators of some conduct disorder and other types of features, because people usually they said, well, he didn't act out early, and you need those early life qualifiers for antisocial. Further on the severity spectrum, then you would hit sociopathy. So if you have your antisocial individual and they have a degree of sort of EQ, for example, and they're more socially adroit, they are able to talk people into things, you see that they're able to pull people to them, manipulate them more, so on and so forth. Then we've moved up the severity spectrum to sociopathy. Then moving up, now you see that certainly much more violent, no remorse, no physiological response. You even have a neurological deficit. So you see a greater degree of impairment and severity, and that would be your psychopath. So the umbrella term, the DSM doesn't talk about sociopathy because they have associated features that encompass the differentiation between sociopathy and antisocial. Now, they don't talk about psychopathy because, and they actually say this in the book, if you want to know more about psychopathy, go look it up, because they just don't have room in the book. I mean, now they could probably digitize it, but they're not going to spend all that money to do the research and so on and so forth. So now, if there's two models of personality in the DSM, and that is, you have a section 2 model, and those 10 personality disorders are from 1980, and the criteria has changed very little since 1980, and it was originally designed to be categorical, light switch, on, off. You got it or you don't. Then we move on, we get to DSM-5, realizing these are more spectrum-like disorders, but now we have an alternative model of personality, and that has a specifier for a psychopathy. It's a psychopathic specifier in the Section 3 model. The Section 3 model is much more beneficial. I think it is more applicable. I think it really hits a lot of detail as it relates to diagnosing these various personality disorders, but people just haven't embraced it. And I hope that they do. I even wrote a book on it, how to make it more clinically advantageous, how to utilize it in various treatment settings and clinical settings. But people, I just don't think that a lot of people have grabbed onto it, which I think is too bad. It's brilliant. I think it's absolutely brilliant.
Okay, well, this is really, really useful mental model and terminological information you're giving us. With sociopathy and psychopathy, or with antisocial personality disorder in general as an umbrella term, are we talking about the visible traits, or are we talking about the underlying cause? And what I mean by that is, if I say somebody's blind, I'm talking about the outcome of the condition that they have. But they might be blind for a variety of reasons. They might have macular degeneration. They might have been in a car wreck and had their eyes severed. They might have been born without eyes, something like that. So, like, are psychopathy and sociopathy, are these descriptive terms of what could be multiple causal relationships, or are we talking about, like, it's the mental equivalent of diabetes, where there's a very specific thing that's happening?
hmm I think that what we're typically talking about, most of the criteria throughout the DSM is going to be behaviorally based. Now, some are going to have more emotive components, like borderline personality disorder has abandonment, also has emptiness. So those are the more emotive components. So I think for your sociopath, you see that sense of remorseless. So we're getting into more of an emotive component, lack of empathy, emotive component. So I think that there's a little balance of both, but the majority focuses more on behavioral. They don't focus too much on causation, like what could have caused this. There's so many variations of things that can cause it. Um, I've worked with individuals that were just law-abiding citizens, just sort of doing their thing, get in a car accident, have frontal lobe damage, following frontal lobe damage. Then they have rage episodes. Those rage episodes, then we see stealing, we see alcohol, drug abuse, and a lot of times the family is often like, who is it? It's not like him at all. And again, so that would be subsequent to the brain injury.
Right. Okay. And I would imagine that there's a lot of debate as to what causes these things. I mean, with virtually anything we talk about, there's some degree of genetic predisposition towards environmental factors. So, like,
Yeah.
alcoholism, there appears to be a genetic component to it, but also, if you're drinking all the time, or you're in a culture that drinks all the time, and you drink more and more, so it's probably not 100% either thing. Same thing with sociopathy,
Yes.
psychopathy. There might be genetic features, there might be injuries, there might be upbringing, parental strategy, stuff like that.
Yes.
Some multi-causal factor.
Yes. Absolutely. Absolutely.
Okay. To muddy the waters even more,
All right.
muddy them beyond this,
That's
where does a narcissist fit into this? Is a narcissist a type of sociopath, or are we talking about a completely separate phenomenon?
That is a completely separate personality type. So now you can have individuals with narcissistic personality disorder with antisocial traits, psychopathic traits, sociopathic traits as well. But if you're talking about, is narcissism on that same spectrum, or narcissistic personality disorder on that same spectrum, it's not. It's not. So they are distinct.
Could be either. They're orthogonal to one another. They're not. Yeah, they're separate phenomena, but they could overlap.
And I think that people confuse it because of the self-serving aspect of antisocial, sociopath, and psychopath. So moving forward, if so, I'll just say like antisocial, and we'll know that that's the umbrella term. Otherwise, then each time I'm gonna have to say all three. But okay. But so if we're looking at antisocial and we're looking at narcissists, so you can have overlap, but people get confused because they're like, oh well, they're just out for themselves and they don't care about anybody else. So that's kind of where there's a lot of colloquial confusion. So your narcissist may lack empathy, but interestingly, and there's a lot of really cool research on this, that actually narcissists have empathy. I mean, when they participate in studies, they have empathic responses just like you and I. But then when you process subsequent to the research response, oh, you seem to have an emotional response, but yet you say you really don't have any value for what's occurred. And it's because they're like, well, yeah, I mean, what do I care? Because if it's not, again, if it's not going to help me look better to others, if it's not going to meet, and they don't articulate it this way, but if it's not going to meet my ego's need to be recognized, to feel important, and to get attention, then what am I have to be empathic about? So, for example, when I work with individuals along the narcissistic spectrum, typically what we're doing, we recognize that the empathy is there. So we don't have to, and we can talk about, there's treatment for narcissistic personality disorder, but there's management for antisocial personality disorder. Very, very different. You can treat narcissist personality disorder, but you really, and there's 70 years of research that supports you really can't treat antisocial personality disorder, but I don't want to make that a blanket statement because conduct disorder you can treat, and conduct disorder you can say is just that pre-antisocial stage. So I don't, and I don't want to confuse folks that are listening or anything like that. So let me just give you an example. Okay.
Yeah.
Okay. So if I'm working with someone who has narcissistic personality disorder, I know that they have that empathic ability, but they just don't really see the investment unless it's a direct response to them. And in doing that, what I start to do is I start to phrase and interact with aspects of how they see themselves and others to their benefit. So, for example, Michael Scott on The Office is a great narcissist, right? He's sort of likable. Oh, yeah. Oh, he's narcissistic personality disorder for sure, all day. He's a great, yeah. Yeah, because think about it. You don't really like him, right? And you certainly don't want to work under him, but he's kind of funny to watch. But he's funny because it's like, whoa, I would never do that. But your narcissist is like, well, it serves my benefit. And a lot of times they are not good socially because they're too self-invested. So with Michael Scott, for example, he hates this guy Toby in there. And there's one scene, and I show this when I do seminars, I'm teaching other mental health providers. And there's one part where Toby is talking about his family and, them getting divorced and having to pick between his two parents. And Michael Scott pushes his food off the table. He just is like, and just drops it, right? No empathy for what Toby's saying or anything like that. But he feels it. He feels that empathy. You would see that physiological response, right? You know that he is uncomfortable, but Toby isn't worth his ear time. So let's say that Michael Scott does that. And then he has to go to EAP, an employee assistance program, and they're like, you can't treat your coworkers this way, so you got to go see Dr. Fox. Comes in to see me. What narcissists want is to feel socially potent. And you have to then frame things that go from maladaptive behavior, pushing people's food on the floor, to adaptive behavior. So how can you frame that behavior in a more adaptive way? So Toby's food doesn't end up on the floor, and Michael Scott still gets his needs met. We all have narcissism, right? So hopefully it's healthy narcissism, right? Belief in ourselves, self-efficacy, so on and so on. So for Michael Scott, what we do is we start framing things to his benefit, and we can teach him something called selective attention, right? You and I probably learned this very, very early on. Selective attention is somebody sits down at your table and they're droning on about something that you could care less about. I don't think, Andrew, you seem like a nice guy. I don't think you and I are going to throw somebody's food on the floor, right? And we might actually just sit there and kind of like, okay, let them drone on and on, right? But what we'll do is we'll use selective attention. We might click our switch up in our head and be like, all right, I'm going to think about going to the grocery store or walking my dog later or seeing, my partner, whatever it is, right? But we're not going to act out. So what we do is we teach that to Michael Scott, but we have to couch it in that it is socially potent, because what happens is that people then can see that perhaps you're patient, perhaps you're understanding, perhaps you're able to manage yourself, and you're able to just sort of tolerate things more. And people gravitate to that. And when people gravitate to that, they see who you really are and what your goals are. And it's turning maladaptive behavior into adaptive behavior.
Okay, this is fascinating. There's a lot to take into. I want to make sure I'm processing this. So when we're talking about antisocial disorders, there is limited or stunted empathy. With narcissism, the empathy exists, but there's a disconnect. So I experience the empathy, but it doesn't somehow translate into my actions. So I'm trying to put myself in the mindset here. Maybe like I don't feel like I'm a particularly gut thinker, but so maybe I'll feel something like in my real life, I'll feel something in my gut, but it won't. I'll feel it, but it doesn't intrude on my thinking. I've not been trained in such a way that I can go, oh, my gut really tells me I shouldn't buy this car. Whereas somebody that's more balanced might. So is it kind of like that, where like I'm like, oh, I feel bad. This person was really hurt, but it somehow doesn't connect with my brain, and I just keep doing whatever I was going to do.
It has to do with buy-in. So how much buy-in do you have? And if you have more buy-in and you realize that it's to your benefit, the more likely you are to feel that sense of empathy and connect to that other individual. So how does it serve you? It's not necessarily just the car. It could be like, oh, is this a, fancy Porsche, right? That maybe, or your partner be like, ooh, Andrew's slick, or is it, a 1982 Accord? Nothing wrong with that. But, whereas you might get less of a sort of, a glorification type of response. People aren't going to be like, ooh, Andrew's killing it. Yeah. Do you see what I mean? So it's more about buy-in. Is it worth it to them?
Got it. Okay, so they'll experience.
Yeah.
Okay, so they'll experience the empathy. Then there's an immediate like, well, does this benefit my standing in the room? If I
Yeah.
act on this empathy, am I going to become more socially potent, and
Right.
am I going to be more liked and more esteemed? And if I don't see that happening, I don't care.
Exactly.
If I'm hanging out with, theoretically, let's say there's a group of people that think if you're homeless, it's your own damn fault. You should have worked harder. And I'm hanging out with these people. We pass a homeless guy, and a narcissist. I'm the narcissist in question here. I feel empathy, but I know it's not going to impress these dudes I'm walking with because they don't care anyway. So I'm not going to act on it because it serves me no purpose.
Yes, that, and then amplify it. Amplify it for that particular example, I think a lot of people would feel social pressure, maybe not to say anything, but your narcissist is going to feel it so much more intensely because they're going to think that they have to not only be a part of the group, but they have to lead the group. They have to be the shining star in the group. So that's additional social pressure because they're compensating for typically fear, doubt, shame, inferiority, right, and guilt.
I'm glad you brought up Michael Scott. By the way, I think your metaphors are great. Like,
Oh,
I
thanks.
think that you're clearly a good person to do these seminars with because you're making it very relatable to somebody like me who's never cracked a psychological book.
Oh, great.
I have watched The Office, though.
Yeah.
And
I knew I'd get to a show, Andrew, that I was going to keep going.
I liked Breaking Bad too. Great show.
Okay.
Better Call Saul, fantastic. So I was talking to my old roommates years ago about Michael Scott, and one of them was like, he is the bad guy. He's an evil person. And I argued with her. I was like, no, he's not evil. He's just a deficit of love. Like he's a character that is completely built around this desperate need to be popular and well liked. So like I look at Michael Scott and I see this very sympathetic character because he there's such boundless insecurity in him that he just wants people to like him. So I see him as like a child that has not like really grown up. But am I just describing narcissism? Is that what narcissism is?
Uh-huh. Oh, I thought you were. Yeah. Yeah. Yeah.
Okay.
Yeah.
Okay, because when I think of narcissism, like, and this is why I need to hang out with more psychiatrists and psychologists, is like I have multiple friends who describe their ex-girlfriend or boyfriend or spouse as a narcissist. And I'd say this is very common too. I'd say 8 out of the 10 people that I talk to, when they describe them, I'm like, I don't really think that your ex is a narcissist. I think that you're saying that they're a really bad person. And to add a little bit of color to it, I think you're trying to convince yourself that it's a good thing the relationship concluded because they're just irredeemable. And that's an easier thing for you to do than to go, oh, it didn't work out. Maybe it could have. But there were 1 or 2 where they described horror stories where like one of my friends, her ex was cheating on her for years. He had a burner phone. He like got into his burner phone, found it, confronted him with the evidence, and he was enraged that she would violate his privacy. So he'd been cheating on his wife for years, and then when she, and like that to me, I was like, okay, that's like that was what I thought narcissism is. Are these one and the same? Like I guess previously I thought of narcissism as a kind of like total myopic selfishness where all other people in the world are props and I don't care. But it sounds like it's more of a I desperately want the approval of everyone around me to the point where I make antisocial decisions.
Well, okay, yes and no. So I think that the over colloquial use of narcissism has caused a lot of confusion. So a lot of people's exes, you say, oh, he was a narcissist. But you got to kind of chalk it up to, well, that's really like a colloquial use. What you mean is that he's a selfish jerk or she was a selfish jerk.
Right. Yeah.
Selfish jerk doesn't equate to narcissism. I mean, it may be a lack of empathy. It may be that maybe they were selfish lovers. It may be, they were selfish. And so I think that what happens is that certainly you have this breakup. And there's the acrimony with the breakup, and there's all those issues. And they were selfish, and they're this horrible. He's a narcissist. She's a narcissist. I get a lot of emails that tell me, my boyfriend, my wife, whomever is a narcissist. I would say probably 9 times out of 10, they're not. 9 times out of 10, they're just selfish. They're just more focused on themselves than they are with someone else. That's not narcissistic personality disorder. They may have some narcissistic traits. They may be selfish, as I mentioned. But narcissistic personality disorder, when you're in a relationship with an individual with narcissistic personality disorder, everything has to be about them. Just like you mentioned, is that if it's not about them, then you have a child with a tantrum. You have, here's somebody who's been cheating on you, and they have a burner phone, and the spouse catches them, and they're like, but wait, you violated my privacy, and you're like, what? But to the narcissist, they're like, my privacy is mine, and when it's mine, it's special. But now that maybe I'm not great. And that becomes a narcissistic wound. And that can be really problematic.
With my friend that had this truly horrible human being as a husband, now ex-husband, like the two things that pop out in the stories that she tells me are he did not believe, or at least he never indicated that he believed he was capable of wrongdoing, that everything was always somebody else's fault. He was always the victim. And then the other bit was that there was a real predilection with having the best everything. He needed to have the hottest wife. He needed to have the best car. He needed to have the best, like everything had to be very, very high status. And it did not strike me in any way as sympathetic or funny like Michael Scott. Like he
No.
struck me as just a genuinely awful human being.
Yeah. Oh, no. And absolutely. But again, I think that so that person sounds like that they would be closer to narcissistic personality disorder than just your average boyfriend or girlfriend or spouse or partner who's just a jerk and a self-focused jerk. Because there's some critical components, right, that you mentioned. First of all, impaired insight. That you see it, this is universal across all personality disorders, is that they have impaired insight. Like you and I, we curb our behavior, our desires, our wants, because we might hurt our partner or embarrass our family or, lose a job or whatever. And we recognize the consequences of those behaviors, certainly in the long term as well as the short term. So we balance that out. Well, individuals with personality disorder, because they have that impaired insight, that a lot of times they don't really, they don't recognize the full scope or the outcome of their behavior. So if we put it, and this requires a bit of it's a jagged pill to swallow for a lot of folks, particularly if we're going to use like adultery or something like that. And what I'm not saying that it's okay. First and foremost, I definitely want to make that perfectly clear. What this is an explanation for behavior. This is an explanation for perspective. And as a psychologist, that's kind of what I have to have. Right? I mean, if I'm going to judge all my clients for their behavior, I'm not going to be very effective. But so it's understandable that a narcissist or an individual along narcissistic personality disorder spectrum who qualifies for the disorder, they're not going to see that. They're not going to recognize that, adultery, like they know it's bad. But I'm not going to get caught because I didn't get caught last time. And if, and this isn't about your friend, because what I'm going to say, obviously, I don't know your friend or anything like that.
Yeah,
But
yeah.
if my wife was, looked like this, or did this, or, was built like Kim Kardashian or whatever, then I wouldn't have to cheat. But she's not, and she doesn't. So that's really on her. It's really her fault, Andrew. And she really needs to get herself together, because if you make yourself high status enough and high value, then I wouldn't have to cheat. And what happens is that being in a relationship with a narcissist, there's gaslighting. So is that they are skewing the other individual's perception of self, other, and their world. And they do it, the good ones do it little by little. Right? It's like building that Lego brick house, right? You've got all different sizes, but they know the strongest one is these little bricks that I keep putting on. So I'm going to make you question your value, how you see others, and who you can go to for help. And it's not conscious, because these behaviors become almost ingrained as if they're survival based, because typically in their background, in their history, in their development, they needed those strategies in order to get through their early home environment. Could be a relationship, could be a teaching situation, in school, something like that, in order to get recognized, something like that. So if you go back far enough, usually there's some trauma in their background. There's some type of neglect. Again, it doesn't justify inappropriate behavior, but it can sometimes help to make sense of it.
With narcissists, because there is a tendency, let me rephrase this. All of the personality disorders, as you say, have a kind of insight blindness to them. Are they capable of realizing they have the problem? So, like, I when I started learning about this, my first question was, "Oh shit, am I a narcissist?" And I'm told by people that that is not typically how a narcissist would think. That because that would imply that there's some fault. But can narcissists become aware? Oh, I am a narcissist. This is something that I need to work on. And can they in fact work on it? Like if Michael Scott does serious therapy, can he mature to the point where he is no longer a narcissist and he's behaving in a empathetic adult manner?
In a more adaptive manner. And that's where I think the focus has to be on going from adaptive, maladaptive beliefs, behaviors, and patterns to adaptive belief behaviors and patterns. It's learning those things and using different methods in order to get your needs met. So if you change, for example, if you change Michael Scott's behavior from throwing Toby's food on the floor to perhaps using selective attention, flipping that switch, is he no longer a narcissist? A lot of those values are there. Hopefully he's developed a little more insight. He has a little more self-awareness, so on and so forth. But changing those behaviors, you wouldn't be able to tell, right? And so, and people get caught up in, is it a cure? So there's no cure for personality disorders. But what you can do is you can help the individual go from maladaptive to adaptive. Now, do narcissists ever say, oh, I'm a narcissist, and oh man, what am I going to do? Oh God, this is terrible. Interestingly, and we're getting into a tricky area, but I would say about 8 years ago, people seemed to focus more on, am I a narcissist or am I not? Prior to that, I can tell you how many emails I got from men, women, others, whatever, saying I could be a narcissist. Oh my God. Zero. Zero. Right? So now, about 8 years ago, then I start, people are writing me and saying, I think I'm a narcissist. I think, and then covert narcissism and overt narcissism it's becoming more popular in the general population. Whereas we see your overt narcissist, now it's going to get muddier, Andrew, so hang on, here we go, right? You got to get your boots on, all right? So you've got your overt narcissist. That's your classic grandiose narcissist. That sounds like your friend's spouse, ex-spouse, right? Fits in. Michael Scott, classic grandiose narcissist. So there's another subtype that's called a vulnerable or covert narcissist. And what we used to believe is that they were distinct personality narcissistic types. Actually, what we found is very, very interesting. So the original research was by Dr. Wink in 1990, excuse me. And so we kind of held on that ideal for a long time. Then Dr. Campbell, I believe he's at University of Pennsylvania, or he was, I believe. Anyway, so he finds, you know what? This covert and overt narcissism are two sides of the same coin. And just and Dr. Rottingham, and she's doing amazing work, and they're finding all of this support, and it's so cool because here's what's fascinating is that you can have a vulnerable narcissist. Your vulnerable narcissist approaches you like this, Andrew. I really, and this is not mockery in any way. This is only for illustration. Okay, so he come up to you and say, Andrew, I suffer and I hurt and I'm so lonely. And of course you're empathic and you're like, oh no, Dan, that sounds bad. Da, da. No, Andrew, you don't understand. I am more lonely than anyone has ever been lonely in the history of the world. I suffer more than anyone has suffered more in the world. And we see that context, they qualify for narcissistic personality disorder. They get attention through it. They are reluctant to change. They have impaired insights to how they manage those various issues that make them feel so broken and hurt. But interestingly, they come into treatment typically as a vulnerable narcissist. So now we start to see people that are writing me saying, oh, Dr. Fox, I think I'm pardon me, excuse me. They write me and they say, oh, Dr. Fox, I think I'm I'm a covert narcissist and I'm ruining my family, things like that. And that's kind of typical because the covert narcissist would be suspect of, oh my God, I'm so broken, I'm so hurt. But once we get to strategies, once we start working, what happens is they are so intractable to that level of hurt because it meets the narcissistic need. That they feel special, not special good, just special as seen, heard, unique, and they really are wedded to this degree of narcissism. But what happens, they come into treatment, they come in with a vulnerable type. So we're working for a while. I'm teaching you that social potency strategies, how to see different aspects of the world. Let's say that you start to restore, and we'll talk about narcissistic wounds in just a minute, and American Idol in just a second, just to further provide clarification. So they come in, then we do some ego restoration, which is like, we help work through that, whatever that wound was, whatever that narcissistic wound was. Then what happens is that other side of the coin pops out. And this is where a lot of mental health providers contact me and say, I didn't know this guy, let's say guy in this example, I didn't know this guy was a narcissist, came in so sweet, so hurt, just really like needy, just begging for help. And then they turned on me. They didn't turn on you. They were always there. You just didn't see it because that side, the vulnerable side of the coin was up. It just flipped. You didn't see it. And mental health providers typically don't see vulnerable narcissism because it isn't what they expect. So they miss it, particularly in couples. A lot of couples, if you have a vulnerable narcissist, you have the partner complaining, oh, he or she is so selfish and and you're like, I don't know, this person sounds terrible. You're saying that of the partner. Then let's say 10 sessions down the road, if it goes that far, then you start to see, whoa, he or she is like that. Oh my God, because the coin flipped on you. So it really, and just like I said, I warned you, we're muddying the water. So we can get into narcissistic wounds, which I think provide a really good example as to why this particular aspect of narcissism comes out. But I just
because I'm also fascinated, where all of this originates from. And we talked a little bit earlier about, there's some interplay between genetics and upbringing, but at least with narcissism, it sounds like this is like a childhood coping strategy to trauma based on what you said. So what are narcissistic wounds and how do they factor into this?
So narcissistic wounds are typically something that has occurred that goes right to the core of the individual. So you and I have particular things because of our background, our experience, so on and so forth, that if somebody brings it up, we're probably going to have a pretty emotional response. I call these emotional buttons. I think there are triggers and emotional buttons. Triggers are things that are like pet peeves, as I conceptualize it. Somebody cuts you off and you're like, oh man, and you're frustrated. But an emotional button is something happens, someone says something to you, somebody does something, and it may trigger a memory, an old feeling, perhaps an early attachment memory, whatever it may be. And then you feel this flood of emotion. You have this flood of images, and you just sort of are caught up. It's a deeper responsive level. I think that it is a mistake to say, oh, no, well, you were just emotionally triggered. I think it's an oversimplification. You have emotional buttons that are deeper. And when we talk about narcissistic wounds, what we're talking about that individual has experienced something that has this intensive emotional button. So let's talk about American Idol. So American Idol, right? You've been practicing, and Andrew, just to have fun with you, if you're up for it, you're going to go on American Idol, right? You've been practicing your whole life because you seem like you're ready for it, right? So you've been practicing. You're sure. So you've been practicing your whole life, right? You've been singing. Everybody's like, Andrew, you're the best. You're the best singer. You're so wonderful, and all of these accolades, and everybody's flowering, you with all these wonderful, kudos and all. Oh, you're going to go on American Idol. Oh, you're going to be wonderful. So you go on there. You have 3 identified experts, right? Now, when I've only watched one season, it was a very long time ago. It was Randy Jackson, Simon Cowell, and Paul Abdul, right? So they come on there. And these were in the first few shows, right? They were like the loser shows. And so you go on there, right? And you're ready. You're going to sing your heart out, Andrew. Here you go. Here you go. And you go up there and you sing your heart out. And they tell you, you stink. Oh my God. You're the worst singer we've ever heard in however many years. Da, 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 da. That's a narcissistic wound. That goes to your concept of self. That goes to your value, because over time you have, perhaps it's, and we're not blaming anybody because that's a waste of time. I don't believe in blame or fault. But right over time, everybody's saying, oh, you're a wonderful singer, da 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 da. You internalize that to make it part of who you were, which then you were great, unique, special, so on and so forth. Now you have these 3 experts that tell you you stink. You got 2 ways to go. That is a narcissistic wound. It can go internal or external. If it goes external, this is when you saw people saying, well, those 3 idiots, they don't know what they're talking about. I'm going to keep on going, and I'm going to come back bigger and stronger than ever. So you are managing that narcissistic wound more effectively. You're not going to destroy those 3 objects, which is what most narcissists do, is that if it was somebody like, those 3 celebrities, you're not going to be able to do that. In like the working world, if you incur a narcissistic wound from a coworker, then you could be passive aggressive and undercut them or embarrass them or do something like that, and that would restore your ego. But in this case, you can't. So, and this was always scary to me, and I really tried to look it up, and I could never find it. How many of those kids go inpatient after going on American Idol? Because these are the ones that come out, and it was so, oh God, it was so heartbreaking. I couldn't watch. It was so heartbreaking to me, because here are these kids who were built up and believe this about themselves and things like that, and now they're just trounced, and they're out there, they're hugging their family, and they're crying, and they're broken, and all this other stuff. Likely, when a narcissistic wound goes internal, what happens is that anger, loss, regret, remorse turned inward, and that typically becomes depression, anxiety. And how do you manage that? Well, just like we talked about, narcissists aren't real good at managing their issues. They tend to manage it with maladaptive patterns. So then you have suicide attempts. Then you would have increase in probability of drug addiction and alcoholism, promiscuity, whatever else it may be, to restore or blunt the pain of that internalized narcissistic wound.
I so first of all, can I keep you for another 10 minutes, Doctor? I know I told
Oh,
you we had
yeah, I
20
got, you
questions
know what?
for
I
tonight.
actually blocked out 2 hours, so I'm good.
Oh, great. Good. Because I have way more questions, and I was like, damn it, I'm gonna have to squeeze these out. Okay. All right. Here's something I'm dying to know. You mentioned earlier that antisocial disorders are spectral. So you could be, I don't know how you define it, but say you could be like a 2 out of 10 sociopath or a 10 out of 10 sociopath. So
Yeah.
presumably Anthony Soprano's somewhere in the middle because he does love his family, something like that. Whereas like, or same with psychopaths, maybe you have some impulse control or something.
Mhm.
I would assume narcissism's the same thing. So big question here. Are we all on the spectrum? And I ask this because I can be selfish and I can be haughty and have an overly high opinion of myself. I don't think I'm a narcissist, but is it just that I'm a 1 out of 10 narcissist, and if I got up to a 4, then I'd be a capital N narcissist? Or like I'll have impulse control with ice cream, or
Yeah.
I'm trying to think. The other day I was having dinner with friends and we were discussing etymology, and the term retarded came up, and I was
Mhm.
like, oh, this is an interesting term because it originally meant it was originally not meant to be an insult, but like one of my friends was like would only say the R word. And I,
Mhm.
I was like, oh, like I don't think that rule applies here or to me, even though you're offended by it. This is ethically. So like, am I mildly psychopathic when it comes to?
No.
Anyway, yes. Are we all on this, or is this a category other people get to and then it's spectral?
So I think that what it comes down to is whether or not you can hit, let's just say, you hit that spectrum of disorder. That spectrum of disorder is that how maladaptive is your behavior, and does that behavior cause socioeconomic dysfunction? So the universal criteria across all disorders in the DSM is that it has to cause socioeconomic dysfunction. So it impairs your social functioning, impairs your economic functioning, academic functioning, right? And so on and so forth. So all of those aspects. So first, you binging on ice cream, right? You have poor impulse control. I mean, I do for Ben and Jerry's New York Super Fudge Chunk. I mean, absolutely. But that doesn't necessarily mean that I'm personality disordered, or, I have an impulse control disorder. Now, it could be problematic if I'm eating New York Super Fudge Chunk 4 times a day, going through, 2, 3 pints a day, things like that, because now it's impacted my health. It's probably impacted how well I'm doing my job because all that sugar is going to make me pass out, and so on and so forth. So for us to have various traits of these disorders is not unusual. Aspects of these traits is not unusual because we all have them. But do they reach a level where they add to intensive challenges functioning and getting through relationships in order to get your needs met, the needs of your household or friends or family or so on and so forth? So that's when it becomes a problem. So we all have these different aspects, but how often are they exhibited and to what degree? Once they're exhibited frequently enough to impair your socioeconomic dysfunction and to a degree that they impair your healthy functioning, then it becomes a problem. Otherwise we just all kind of go off the rails every now and again.
Okay, all right. So maybe I'm using the wrong mental model here. It's not so much that it's like a 1 out of 10 and everybody's somewhere on it. It's more like there is a basket of traits, and the average person might have one or two,
Yeah.
but once you have enough of the traits that it's causing problems, that's when we start to diagnose you as being antisocial or narcissistic. So like
And they're severe enough.
theoretically,
And
yeah.
they're severe enough and lead to maladaptive belief behaviors and patterns.
So like, okay, this is a very weird example, but it's fresh on my mind. One of my friends here in Austin is a data analyst and sex worker named Ayla. She's
Mhm.
a internet personality,
Right.
and she did folks, sorry if you got kids in the car, pause this bit. She did a gangbang for her birthday and wrote an
Mhm.
email about it. It was a big viral thing. So like, and she talks in the email about how she knows that this is not societally acceptable and she knows that it has consequences,
Mhm.
but she doesn't think that there's anything ethically wrong with it. Or a much more benign example that I probably should have used was like, maybe I don't mow my lawn or something, and people think
Right.
that that's not a normatively acceptable behavior. If you have one or two of these things, you're quirky. If you have these things to the point where it is causing a breakdown for you in your relationships and your income and your health, then you're on this. Then you're categorically within this antisocial thing.
Yes. Yes.
Okay,
Yep.
great. Okay,
Yeah.
so I
Yeah.
have a lot
Perfect.
of
I'm not even
quirky
going to
friends
add to it
then.
because I think you hit it.
Great.
Perfect. Perfect.
No. That yeah. Because I can think of like in my life, I have plenty of people. A lot of my friends are it's not that they are unethical or unempathetic, but I have a lot of friends that have a much lower reactivity to linguistic transgressions than I do or other people do.
Hmm.
And if it's just that one thing where they're like, no, I don't care about words. I'll use words. I don't care if you're offended. That could be a psychopathic trait, but only if it had lots of other things accompanying it, where there's also impulse control, there's also lack of remorse, there's all of those different things. So you might have lots and lots of people that have one or two of these traits, but in isolation, that's okay so long as they're a functional adult.
Hmm. Yep. And if that person so if they don't like you using what they call the R word, so then if we want to add a little flavor of psychopathy in there, what they would do is, well, I'm going to teach Andrew a lesson. So they go out, they buy some spray paint, and what they write on, on the side of your car is, right, I love the word R word, right? And then it's like, whoa. But that's like,
Okay.
yeah, yeah.
Where it's like gone beyond like this is slightly out of the norm to like, oh, this is causing problems and like makes me worried about you and or us or that kind of thing.
Hmm.
Okay.
Yeah.
With impulse control, because that seemed to be something that like the narcissism, and you blew my mind bringing up Michael Scott. I'm gonna have to like take a walk after this and
Yeah.
rethink how I view the universe because I have no idea this character that I found funny was a narcissist. Um, with narcissism, it sounds like it is this kind of like I need other people to esteem me, and everything kind of pinwheels around that. With antisocial disorder, it sounds like impulse control is a big part of it. I'm curious, does that does that keep, how do I phrase this? Does a lack of impulse control keep sociopaths and psychopaths from rising to positions of true damage? Like if I am so impulsive that I'm not going to become a criminal mastermind because I'm too impulsive to pull it off. Like, or is it just that we're catching the ones that are bad at impulsive behavior,
Mhm.
but the non-compulsive sociopaths become, like American Psycho characters?
Hmm. So I think that impulse control again would also be on that spectrum as well. And I think that what happens is that if we just look at personality disorders overall and we look at that spectrum of impulse control, and what happens is a lot of individuals with personality disorders, they have a lower threshold and tolerance for self-control, right? They have a lower ability in which they can control it. So they get what I call core content activation, right? Which goes to that center of self and so on and so forth. And how well do they tolerate it? Well, they have a very narrow tolerance degree, right? Of space. But what happens is you and we have a much larger one. So we can tolerate greater degrees of impulse control. Now, when we talk about, like, if we're going to go back to antisocial, and because we're in an election year, and we're not going to name anything specific or anything like that, but politics can be on everybody's mind this year, so on and so forth. There are
Right.
individuals that are, but it isn't just in politics. It's also in business. It's also CEOs. It's also and elected officials. We see a lot of sociopathic tendencies in elected officials and in CEOs, but we also see them at McDonald's, and we also see them at wherever, at Voodoo Donuts or wherever else. It may be on 6th Street, right, in Austin. But what happens is that they can rise to those levels because they are able to do things you and I are not. How much are you willing to sell out your values? And this isn't true for all politicians. It isn't true. These are not, just global statements. Oh, it pertains to everybody. Obviously not. But for those that qualify for sociopathic behavior, narcissistic behavior, so on and so forth, they're able to do things or willing to do things that you and I are not. Right? We're not willing to take money from people, perhaps for causes that we don't believe in or that go against our personal values. There are people out there who do that and are like, well, I'd rather have the money and have a really nice house and be able to influence to my favor. Well, that's a sociopathic antisocial perspective. For your psychopath, it'd be really hard. It's possible because anything's possible, but it would be really hard for a psychopath to move up the ranks. I mean, maybe like a local office, I think, but they're just not good at balancing social engagement. Like if they were out there, stumping, and they're out there saying, vote for me. I mean, they're really not going to follow that up with anything really believable or interesting. You're
Yeah.
going to be like, huh? I mean, they're going to say, look, you know what? Voting for me, I mean, I don't know. Probably got nothing else better to do. I mean, and y'all don't look that smart to begin with. So,
Yeah, there's a.
yeah.
I interviewed Tim Heidecker like 3 or 4 years ago now. He's a comedian, and he had just done a film that was he was running as a political candidate in this film, and the opening scene is him talking to a lady, and he's like, "Hey, I'm Tim. I'm running for DA," and he like says all this, and then like she asks him like, "So what are you running for?" And he goes, "DA. I told you that twice." And it's funny because you would never expect a politician to like be like, "Hey, dumbass."
Right.
Like, but like that kind of like a psychopath would not be able to restrain themselves, whereas
Right.
like a smooth political operator would be like, "That's a great question.
Yeah.
That really made me like." So there's that social finesse.
Yes.
I interviewed a guy named Rutger Bregman a couple of years ago, who's a really fascinating thinker, and he said something very similar to what you're saying, which was that there's a kind of selection process that occurs for, I guess we call it sociopathy in group hierarchies.
Mm-hmm.
So, like a mayor personality is more likely to want broad consensus likability. Where like I want to go out and be able to go to the diner, and I want people to like me. I fall more into this category, and I suppose I am more likely to be a narcissist than a sociopath based on what we're talking about. But
Or
well,
mayor.
I want everybody to like me, right?
Yeah.
Yeah. Well, so I don't want to like I wouldn't want to run for office if it entailed having thousands of people hate me. That does not sound pleasant to me. I like and according to Rutger, like your sense of shame is useful on a local level because it restrains your behavior and it makes you broadly popular. But that becomes a hindrance the higher you go up. So if you're running for Senate, you know that you need to piss off the other team and piss them off really badly because that'll animate your team. So if you don't mind thousands and thousands of people hating you, you can do quite well. Or like on the corporate side, it would I have several friends that run businesses, and it's very difficult for them to fire people.
Yeah.
They don't like doing it. They don't want to fire the person. They've developed a personal relationship with them, and I've watched them like sweat blood trying to make that professional relationship work because they really don't want to fire that person. It's like it kills them to do it, right? But if you were a touch sociopathic, where like not to the point where you were a full-on sociopath, but just where you didn't have quite that developed empathy, where you could just look at the numbers and go, "Oh yeah, you're economically unproductive. I'm going to fire you." I would think that guy would be more likely to become CEO long term.
Could be. I mean, absolutely. We would be looking at other personality factors, but sure, that would be a big one. That would definitely be one in that person's favor when you talk about the corporate ladder. Absolutely.
Well, you said that you can see these, in an election year, you can see narcissistic or sociopathic tendencies in politicians, but you can also see them at people at McDonald's. Are these traits evenly spread throughout the population? Do they clump up? Are people that are sociopaths tend to do better in hierarchies than others, or is it just equally distributed and the factors are unrelated to the disorder?
Yeah, I think that so here I think if we're talking about sociopathy, so if we look at antisocial personality disorder, and we also always have to bear in mind the lens that we're using whenever we're looking at any type of prevalence or anything like that. It's always skewed towards the individuals that are willing to respond, that have responded, so on and so forth. So
Right.
it does tend to be skewed. So I got to kind of hedge my statements a little bit here, but I think that I would say that because of what's involved, the higher up you go in the political or the corporate or business environment, sociopathy is going to get you only so far. Presumably, there should be protective mechanisms in place to prevent it, but the society as a whole has to put those protective measures in place. If they don't, then it's a free-for-all because once you give them an inch, they take 100 miles and they continue just to tear it up, tear it up, tear it until they reach that ceiling. So a lot of them eventually early on is that they're spit out, right? That they do something inappropriate, whether it's adultery or it's and we don't know all the factors or what that's involved in a person's life, but there's tons of politicians or business people that you hear about, going to massage parlors or going to having girlfriends, boyfriends, sending pictures of their genitalia, da 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 da, and all that stuff. I mean, is that really sociopathic? But if, let's say, they have the other factors, so sociopathy is going to tell them, I'm going to send a lot more pictures than perhaps the person who doesn't have a lot of those traits, because they're going to balance it. They're going to be like, oh, I got away with it once or twice or 10 times, man, I better be careful. Sociopaths don't have that, because if things get really bad, I'll just crush you.
Does it self-select over time? So I'm thinking like, um, again, I guess it wouldn't make you a sociopath, but I would assume that having somewhat somewhat blunted empathy. Like I would be a very poor hiring and firing manager. I'm empathetic enough that I would not. It would be very. I could look at the facts and go, I need to fire this person, and it would be very difficult for me to do it.
Mm.
Right. So somebody that is less empathy than me would be better being in a hire and firing role. But if they're getting to the level of outright sociopathy, I would think that their ability to maintain advantageous alliances over time would eventually conclude, because like you and I could be in a business. I'm assuming you're also not a narcissist or a sociopath,
God, I
but
hope not.
you and I could be in our mutual businesses for 20 or 30 years, and we might have friends that are no longer advantageous to us career wise, but they are still our friends, and
Mm.
so we're going to help them. And could be 10 years where we're just buddies with them, and we don't get anything out of it other than we like their company. And so we can maintain those personal alliances. But if you're a really sociopathic person, you're much more likely to only maintain those relationships insofar as they can benefit you and to dump them when they quit.
Yeah.
So if you're doing long term anything that involves alliance building, I would think that a sociopath would not be good at that.
And you're absolutely right. And I'll frame it in a very sociopathic, antisocial way. So you're about to fire somebody, right? Well, you might as well sleep with them first, or borrow money from them first, or get something from them first, because then they're fired, then they're out. What are they going to do? Nothing. So you
Okay.
might as well. And so that becomes the antisocial additive. That becomes the sociopathic additive, is that they're like, well, at least I could have sex with them. I mean, that would be kind of cool. Or I could get there, borrow some money from them or whatever, this, that, or the other
Mhm.
thing. Just an extra layer of manipulation. So
Okay.
they just
So
have.
it's not that it's not that the CEO that is just a little bit less emotionally touchy-feely has sociopathic tendencies. That's probably overkill describing it that way. It's not sociopathic until there's a bunch of these things, and they're like the boss that goes like I'm trying to yeah I like sleeps with the intern before dismissing them or
Right.
something, where it's not just that they're less touchy feely than the HR manager. They are looking at people as a spreadsheet of self advancement,
Right.
and they're not thinking about the collateral damage. Okay.
Mm-hmm. Mm-hmm. Yep. Oh yeah. No, absolutely. And
Okay.
it's not all housed in empathy or degree of empathy. It's actually it's this cluster of various features of beliefs, behaviors, patterns, emotions of all those different factors, which is what makes these disorders very, very complex, very hard to manage or treat. So that adds to the complexity.
Um, we had spoken a little bit earlier about lack of remorse. Does that affect narcissist and antisocial disorders? Do they all have that? Is it more on the sociopathic psychopathic thing? And how does it? Can you give examples of how that would manifest in somebody's life?
Sure. So that when we talk about like lack of remorse, I think that you can see that lack of remorse or lack of empathy again in your narcissistic individual. Like they just don't feel bad. I mean, they're just like, well, I'm more important than you, and your feelings aren't that important because I'm more important than you are. So you're kind of irrelevant. Whereas your antisocial spectrum individuals are more about power and profit. Power to control, profit what is in their benefit. So they don't really, that remorse doesn't really factor in because it's a hindrance. Whereas you
Okay.
have that degree of, again, they feel empathy, but they may not necessarily act on it because it depends upon the value of the recipient. How important are you?
Okay. And so one of the important things I've got out of our conversation today is it sounds to me like there is not a glib one sentence description of all of these things that it's just this one factor. That's it. It sounds like these are all multifactorial
Yeah,
and are complex, almost to the point where you need a doctorate in it to be to
almost.
be
Yeah,
analyzing it, describing it
yeah,
all the time.
yeah.
But it sounds like some of the elements here is that narcissists are going to be more concerned with social standing and social status, whereas sociopaths and psychopaths are going to be more concerned with power and personal profit. So a sociopath doesn't care as much about what other people think of me. I just want the money. Who gives a shit what people think of
There you
me?
go.
Whereas a narcissist might be like, I want the money so I can buy a Rolex so people can see I'm successful. I want the money so I can buy a car so people know how awesome I am.
Yes. Yep. Yep. And just to piggyback that, just a little bit. So your antisocial spectrum individual, right? Whether it's psychopath or a sociopath, they don't care how they get it, right? I mean, so like if I want it, if I want your Apple Watch, I mean, I can cut your hand off, or I can just choke you out, and then I'll just take it. Whereas, your sociopath is probably going to be a little more skilled at doing that and talk you into it, and then you're going to give it to them. And then your narcissist is going to be like, I need that Apple Watch. How am I going to get that Apple Watch? And if I could passive aggressively shame you into it, or if they wanted to engage in this long campaign to get an Apple Watch, but how can I manipulate you, or how can I make you feel enough shame, guilt, doubt, brokenness that I can then take this from you, because I want you to think I'm so special. You should give me your last dollar.
Do you have an idea for what percentage of the population is afflicted with these disorders? Because based on what you're telling me, I don't know that I've ever met a psychopath. That sounds to me like a fairly rare
Yeah.
thing. And my
Mm-hmm.
guess is also, given the impulse control and weird dead-eyed logic you've described, if I will cut your hand off to get your Apple Watch, that you're more likely to get weeded out by the criminal justice system as a psychopath than you are as a narcissist or something like that. You're
Yeah.
more likely to engage in behavior that'll get you arrested. So
Yep.
I don't know that I've ever met a psychopath. I might have met narcissists, but I'm not really sure. Or with sociopaths, ditto. So like, what percentage what percentage of the population do you
Mm-hmm.
think would encompass any of these three terms?
So when we talk about psychopathy, so psychopaths worldwide, you have about 1 in 150 was Kent Keel's estimate, but you're talking worldwide. People get caught up in that, because what happens is that a lot of them are incarcerated, typically at higher security levels, more of your max custody levels, things like that. So when we talk about your narcissist, we're right at probably between 1 and 2% of the general population who are actually going to qualify. Traits, or just entitlement, because entitlement doesn't equal narcissism, which people think that, but it doesn't. It's often a very confusing component. But there's so many more people that have narcissistic traits or that are entitled that won't qualify for full narcissistic personality disorder. But you may not want to go get a root beer with them.
So psychopathy, you said it's according to that research, it's like 1 out of 150,
Mm-hmm.
whereas the narcissism would be like 2 out of 100. So it's significantly not. Neither of them are significant within the overall population, but there's still a lot more narcissists than psychopaths.
Mm-hmm. Yep, and their prevalences. So I mean, you have to again look at the whole world. A lot of times, when I mention it, like in videos or anything like that, people are like, well, I could line up 200 people and I'd have this many. Well, I mean, that's what the prevalence says, right? That's the statistic. Yeah. Yep.
Okay. What about sociopathy? Is it same as psychopathy?
Sociopathy is pretty tricky. They don't do a lot of studies on sociopathy. A lot of times they do studies on antisocial behaviors, and so no one specifically addresses sociopathy. Now, there's a wonderful book. It's called The Antisocial Personalities by David Licken, and I mean, he beams right in on sociopathy aspects, treatment. I mean, it's a wonderful, wonderful book. I read it 20 years ago, and it's still very, very true today. But so there aren't a lot of research currently that talks about the prevalence of that. There's certainly prevalence as it relates to antisocial personality disorder, and you're like right around 1% of the general population.
Okay. And then we'll wrap up here in a second. You said with narcissism that a lot of the time that involves childhood trauma. It's some sort of coping mechanism.
Mm-hmm.
With psychopathy and sociopathy, like psychopathy, it does sound to me like a hardware issue based on what you're saying. It sounds like there's physiological problems rather than just software. Like narcissism sounds like a software issue to me,
Okay.
where I have internalized bad programming that is maladaptive, but my hardware might be okay. Whereas psychopathy sounds like your hardware's messed up, like your limbic system has a kink in it, where your adrenaline is disconnected or something like that. So do people that have psychopathy tend to have, I don't know, grew up with lead,
Yeah.
had a neurological accident, got in a car wreck? Is that more prevalent among psychopaths than narcissists?
And I think that's the key term, is that we're going to see a greater degree of prevalence in neurological impairment, or that they've had some type, it could be a birthing issue, could be a traumatic brain injury, could be just a genetic deficit, right? I mean, if it's somebody that's carried genetically, and there is some research to show that obviously it's not 100% or anything like that, but that there could be a genetic predisposition. So dad, let's say, is a psychopath, so that increases the probability. It's not as strong as 50-50. We're talking about, like mothers with schizophrenia or anything like that, but there tends to be a higher probability that that child will then have certainly traits or psychopathy growing up. So, but
Okay.
one of the biggest problems I think that we run into when we talk about, well, is it nature, nurture, genetics, and things of that nature, is that when you talk about something as complex as a personality or personality disorder, you're talking about a combination of particular traits, symptoms, behaviors, and it's hard to lump all that in there because the data gets so messy. But if we talk about something like temperament, so temperament is certainly something that we know there's a high degree of heritability, how well you tolerate dissonance, how you function within that. How do you learn that? We know that there's a family aspect of that. There's certainly an environmental aspect, which is what I mean, but there's also a heritability aspect in temperament as well. So we see that. So you really, I think, to do it justice, you have to look at those particular aspects or specific traits or symptoms of the disorders and talk about those particular predispositions or heritable dispositions. But I think if we look at it globally, it gets so muddy and it gets so messy that it's really hard to pinpoint. You can, but I wouldn't put a lot of faith in a lot of that.
Okay. Although, and then for just myself and for listeners, because when I first started hearing my friends just describe narcissists, like again, light bulb, I was like, oh God, am I one of these people? Like, do I like? But it sounds like for everybody at home, it, the you're not hitting any of these terms until they are causing problems in your relationships, your work, your health, something like that. So we all have some amount of selfishness, some amount of autocentric worldview,
Mm-hmm.
but like just because there's weight on the scale, until the scale comes out of whack, you're not qualifying in there. It's not like you're 8% sociopath or 8%
Right.
narcissist. It's more of a description of when you become problematic. Then we start getting into these terms.
Yes. Yep. How
Okay.
much do those particular aspects cause problems in your life in you earning a living and maintaining friendships and social relationships?
Okay.
Yep.
Well, I think we'll wrap it up.
Okay.
If you want, I'm going to give you a broad, open-ended question to just conclude with.
Yeah.
Given that you've treated a lot of these folks, you've worked in prison, you work in private practice. What are just what are some of the moments that stand out to you in interacting with narcissists or sociopaths or psychopaths in your personal life that would kind of be emblematic of what we're talking about today for someone who might not have encountered them?
I think that the key is to go with your gut. I think that we often talk ourselves out of feelings that we have, meaning that if you meet somebody and something feels funny, you can put attention to it. Don't immediately dismiss it. What is it about that? That's one of the things that was really helpful for me working in prison for 21 years, is that if I would sit down with a guy, a girl, because I've worked with both males and females, and you sit down and it's like, oh, there's something weird here. I would typically either get another psychologist to come in with me, or we would have the officer there, or supervising through a window or something like that. You just go with your gut, go with that feeling. Also, I think when we talk about narcissism, remember that gaslighting is a pretty big tactic. So remember to have a good social network that helps you clarify how you perceive self in the world. And it's really hard to do, and it can be really complicated, but we have to know who we are. And we're currently in a society where people don't really understand who they are, and they're not defining themselves because it's become externalized. Internalize who you are and listen more to your guts. Your guts know. We all have good guts, as I tell my clients. We just have to learn to listen to them more often.
Okay. Well, I'll make more of an effort to do that on my end, although I also feel much more full in my regular heady mental model ways through our conversation today. So for folks that want to learn more from you, if they're in Texas and they feel like you would be pertinent to them, where can they find you for a private practice, assuming you were doing that?
Mm-hmm.
And for everybody that's not in the Austin area, I know you have a YouTube channel.
Mm-hmm.
What kind of stuff do you talk about on there, and where can they find that?
So the YouTube channel, if you just Google Dr. Daniel Fox personality or borderline personality, narcissistic personality, I'll come right up. That'll have me pop right up. My website is drdfox.com, so drdfox.com, and I'm always doing something. Here I am. I'm out here in the Woodlands, just north of Houston, and I do consultations with all folks all over. So, yeah.
Wonderful. Well, I very much enjoyed talking to you, Dr.
Mm-hmm.
Fox. Thank you so much.
Well, Andrew, thank you so much. This was really great. I really enjoyed it. I appreciate it. Thank you.